I want to do a series on surgical hemostasis. I'm just going to touch briefly on the difference between an artery and vein in this video, but you can look much more in depth and detail if you look online on a medical site or in a medical book. So the artery and the veins, they both have the same layers, the tunica intima, which is the inner layer that the blood flows against. Then you have the tunica media, which is the layer that has the muscle in it, and then the tunica adventitia, which is the outer layer of it. They both have the same layers, but the layers in the artery are much thicker than they are in the vein. So you're going to find that the artery is much firmer, much stronger than the vein, which is going to be much more pliable. I guess when I think about it, my mind goes to the advertisements I see for the normal garden hose that is the hard plastic, holds its own shape, versus that cloth, whatever they make it out of, that cloth garden hose that will collapse on itself when there's no fluid in it. So that's kind of the idea of the difference between an artery and vein. When you go to feel an artery during surgery, it has a firmness to it. I would kind of describe it as if you were feeling a piece of cooked spaghetti. It's got that firmness, but of course it has a pulse and it has a little more give than you would if you touched a piece of spaghetti. And it has the pulse, which the vein does not. The artery has the pulse because it's going away from the heart, and the heart has enough pressure to push that blood through so you can feel that the pump of the heart as the blood is being pushed forward. The veins, on the other hand, are very collapsible. They're soft and they're far enough away from the blood pressure from the heart that the blood in it would either stagnate and pool, or else it would even backflow. So you have valves in your veins that you do not have in your arteries. And to touch them, you can barely feel them. They kind of disappear and collapse when you touch as soon as you touch them. So if you're in surgery and something tears, you would rather have an artery tear than a vein, because trying to sew an artery, trying to think of it is like trying to sew a piece of suede. It's got some strength to it. It comes together okay. You still have to be, obviously it's vascular, so you have to be somewhat delicate, but much easier to sew. Whereas if you're trying to sew a vein, to me that has the feeling as if you were trying to sew together a piece of torn penne. And you know how cooked penne and how soft it is, and trying to sew that together. So a vein is much more difficult. And I've been in one case where I was doing a radical neck and the surgeon actually hit the lymph vessel in the thoracic duct here. And that one is like trying to sew wet tissue paper. Such a thin layer of tissue that I was shocked that he could even sew it, because it was so thin and so hard to find and so hard to sew. Now we're talking about this artery and vein. We are not talking about the pulmonary artery and vein system, because that's totally different, and we'll talk about that in some other video. But I just wanted to let you know what the difference is and what they feel like when you're in surgery. I hope this was helpful.